AfriGenetry Link is a movement that connects people of African descent to their identity, their history, their health, and their healing through DNA. I started because I saw a gap. People didn't know where they came from, especially people that were affected by transatlantic slave trade. Families were disconnected. At the same time, we are missing from the data that drives modern medicine. Many people don't know the genetic patterns that runs in their family. And because of that, early awareness and prevention was not applied, which has caused so many deaths. This is about survival. Yes, and it's very intentional. DNA is not divided the way we think. The same DNA that tells you where you come from also carries information about your health. In my college days, I studied biology. All I know is that DNA carries information about our health. But leaving college to the real world, I now understood that DNA carries both. So we are not combining two things. We are restoring one complete story. Your heritage tells you who you are. Your health tells you what runs in your body. You need both to fully understand yourself. Healing starts with knowing. Remembering one of my friends at the age of 30, after his DNA results came out, he discovered that both his parents, mother and father, wasn't his biological parents. It was devastating. But the truth started the healing. So for many people, there is identity gap. Not knowing their roots affects their sense of belonging. And on the other side, not knowing your family health patterns and cost lives. Healing happens when people reconnect to their story and become aware of what runs in their family. And yes, it's deeply therapeutic. This question, I love it. It's just simple. It's just because it's missing. Less than 3% of African DNA data comes from Africa. Yet, we are the most genetically diverse people in the world. This means millions of people are still searching, but the data is not there to give them the full answers. And because of that, it also affects our health. Many medications don't work the same for us because we are not represented in the database and often not included in clinical trials. We are not just filling the gap, we are building the bridge that has been missing. We are solving 4 major gaps: an identity gap, a data gap, a health gap, and a health equity gap. Health solutions are not always built for us, but we are changing that. Both. The diaspora is searching for connection. The transatlantic slave trade caused a hole and a gap that we are trying to bridge. Africa holds the missing pieces. But many Africans, over 97% of Africans, have never taken a DNA test. Entire family histories are not documented. So this is about connections on both sides. Making sure that no one of African descent is left out of the story. All Black communities are included. I was once part of the people that thought DNA was just for percentages. But DNA is not just percentages. It's people, it's its families, it's history, and DNA is health. It tells you where a story begins, and it also tells you what could affect your future. So it's not just about results, it's about understanding your life. Well, this is why we do this. It starts conversations. It provokes people's thoughts. Conversations that many families have never had. Conversations about identity. Conversations about generational health patterns. Conversation about what runs in the family. Conversation of living a healthier life. And conversation about breaking generational patterns that can affect the future generations. Those conversations can lead to prevention, which can save life. AfriGenetry Link is the missing link between communities, people, and institutions. We are not just giving results, we are building a connection. We are creating awareness. We are provoking thoughts. We are guiding people through understanding and through healing. We are bridging the gap of what happened over 400 years, just with the tool of DNA. We focus on both heritage, health, and healing, just because you cannot separate who you are from what runs in your body. And most importantly, we are making sure that our communities are included in clinical trials and we are not left out of the global system. My vision is a world where no one of African descent feel disconnected from their identity or health. A world where our DNA is fully represented in modern science. A world where people can prevent diseases because they understand what runs in their bloodline. I want people to take away just 3 things. You deserve to know who you are. You deserve to know where you come from. And you deserve to know what runs in your bloodline.